Pure Plastic Surgery today, and it's Hump Day with Dr.Earle. I'm glad to have all you guys back. So it's now, I guess, week 2 since we were shut down. So it's week 2, we've opened up. And it's going great, it's going awesome. We've been extremely busy, but we're also very, very happy to be back in the OR, be back to seeing patients. So it's been really great. Things are running very, very smoothly. All the testing, all the protocols, everything is going just as planned. So the patients are happy, we're happy, and best of all, we're keeping everybody safe. Not only from what we normally do in plastic surgery and being in the OR and everything else, but also from COVID-19 as well. So today I want to talk about the Bodytite. Okay, I want to talk about the machine basically and all the different options that we have with the Bodytite machine. Okay, so I'm not sure if the camera do we see down here, but here's the machine itself. Okay, as you can see on the side there, it's the Bodytite Pro by InMode. Okay. And has, it's pretty mobile, pretty easy to move around. You can go into the OR, you can go to the clinic, because it has a whole bunch of different settings and different things that we can do with it. Okay, what's the main type of energy that it uses? The main type of energy that it uses is called RF energy, or radio frequency type energy. Okay, this is similar to other devices out there. The J plasma by Remodeling uses a very similar energy as well. So it is all RF energy based, okay? But what I do like about it is that it has a couple things. One, it has several kind of safety features built in, so it can measure the temperature of the skin both on the inside basically and on the outside of the skin, and it'll tell you once things are getting a bit too hot, a bit too warm, and it'll warn you so that you don't cause any burns or things of that nature. Okay. So it has a lot of safety features built in for that, and then it has a lot of versatility as well, so it can be used for several different things. So we're going to talk about all that here today. Okay, so what can be a little bit confusing is that the machine is called Bodytite, okay, but then it has different probes with like different names to them that are all part of the same machine. Okay, so we can start with the smallest probe that they have, and the smallest probe that they have is this one here. It's called Accutite. So you can see that there. So Accutite is a small probe that is used for very small areas that need some skin tightening. So what are some of the classic areas? One of the classic areas is kind of this area here, the lower eyelid. Okay, so the Accutite works well for the lower eyelid or any small area. So I'm going to show you the probe here. They all come. It's all like an individually packed probe. It's a one-time use, so one probe per patient, then you discard the probe. And this is what the Accutite probe looks like. Okay, that's the Accutite probe. So it's about this big. It's about that long. It's fairly thin, so you can go into small places such as nasolabial folds or underneath the eyes as well. So those are the main indications for the Accutite probe. Then you can then move on to the medium-sized probe, and the medium-sized one is the one they call FaceTite. Okay, so FaceTite is more the medium-sized probe there. That one is a bit larger and more versatile. So you can see that this one here. Okay, so the probe here, it's about that long there. Okay, and that one has the most common indication for the FaceTite is actually kind of the chin and the neck area. That's the one that I like to use for the chin and the neck. But it can be used in other kind of areas as well. If someone is kind of a petite type person, potentially can be used for the arms or other kind of medium-sized areas. Okay, and then there's the actual Bodytite probe, which unfortunately I don't have one here today because we used it up yesterday, and we're waiting for our new probes to come in. But that one is fairly large. So the probe is approximately this size, and that's the one that we use for the bigger areas such as the abdomen, the back, the medial thighs, and for most patients the arms. We would use the Bodytite probe. Okay. All right, so what are the indications for all of these? So the indication is when you have to do a certain degree of skin tightening. Okay, so if you have anywhere from mild to moderate amounts of skin laxity or looseness of the skin, that's where this machine will be very, very useful. Okay, if you have extreme laxity, then you're looking more at a surgical procedure. So, for example, you have extreme laxity of the arm, so you're a massive weight loss patient, you lost 120 pounds, you have those what some people call the bat wings, a lot of loose skin, then that's probably not the indication for this machine. Okay, for that you need your kind of classic surgical arm lift or brachioplasty. Okay, now if it's not that, it's kind of mild or moderate, maybe a smaller fluctuation in weight, something like 20-30 pounds, or some people are just kind of they work out but they have that looser skin with some fat underneath the arm there, then for those patients it's a great indication to do a combination of the Bodytite with some liposuction. Now if you have very kind of tight tight skin, tight arms, then in those patients perhaps liposuction alone would be sufficient. But in most cases, I think the Bodytite really adds to it. It really allows that skin to drape back, and it really gives a very, very nice result without having to have that long scar that goes from armpit to elbow. Okay, so we're trying to avoid that scar. That scar, tends to be a visible scar. It tends to be a wide scar. And so for those reasons, it's not a great scar for the arm lift. It's not a great scar for the thigh lift either. The vertical thigh lift can kind of stick out if you're wearing shorts. Certainly going to be visible if you're in a swimsuit. And so in order, that's why it's a great solution for the thighs as well, where you can combine the Bodytite with some liposuction to those areas.
Can you combine this with a BBL procedure?
Yeah, so that's the great thing about this. So it's not, we're not adding incisions. It's not like we're trying to combine a BBL with a tummy tuck or a breast lift. Okay, so it does fall, within the rules of Florida. So yeah, we can certainly do the max, which is the 4 liters here in Florida, and the Bodytite procedure as well. It's not going to take away from that. We can add as many areas as need to be added as well. There's no limit to that. So for whatever reason someone wants to do like thighs and arms and the chin with the Bodytite and their BBL at the same time, potentially all that could be done. So that's great. So it's one of the great advantages to this as well. And the other thing is, if you want to do it on its own, say you just have one particular area that really bothers you. You're like, Dr. Earle, I really hate kind of my double chin. It's the only thing that bothers me. And what can I do? Then yeah, we can go ahead and do the face type with a little bit of liposuction and not have to do general anesthesia. We can do it under what's called MAC anesthesia, or monitored anesthesia care, which means that we do put in an IV, we do give you some medications through that IV so that you feel sleepy, you feel groggy, but you're not completely out. You're not under general anesthesia. We're not putting the tube down the throat, and hooking up to the machine to help you breathe. So and that we can certainly do for if we're doing just like one area, kind of one smaller area, we can do it that way as well.
Are the results permanent, and do you only need one session?
Yeah, so that's another great advantage. Typically, it's just one session. You'll see some change, immediately, but it's not going to be the final. You're going to see the final result up to 6 months after the procedure. You can see like a gradual, it gradually gets better and better and better over the course of the first few months. So that's another kind of exciting thing too. It just gets, it continues to improve. And then you don't, for most patients, you don't have to go back and do another session. It's typically a one-time type of deal. So that's great as well. Okay.
Why did you choose this as opposed to J-plasma? What's the difference?
Yeah, so the type of energy that they use is similar. They both use that RF type energy, okay? When I was trying to decide, I was choosing between those two machines. The reason that I ended up going for the Bodytite actually there's 2 reasons. One is that I believe it's more versatile. So it has a different range of probes that can be used at different areas of the body. The J-plasma, at least at that time, just had basically the one kind of larger probe that was used for larger areas like abdomen, back, or arms. And it didn't have like the face type, smaller probe for chin and neck. It certainly didn't have like the little tiny probe for under the eyes and things of that nature. And it also does one other thing which I haven't even discussed yet, which we're going to talk about here in a few minutes. So that's one reason. And the second reason is that it has feedback mechanisms that tell you about the temperature, and basically that provides an extra safety measure so that you don't cause any damage basically to the skin and to the patients. Okay, so the J plasma, of course there's all of these things have a learning curve, but with the J plasma there is no feedback mechanism. There's nothing telling you what is the temperature in the skin right now as I'm passing that probe through the skin. This does. So I know I actually set the temperature, I set the max temperature, and then if I'm reaching that max temperature, it will alarm, and that way I know to take my foot off the pedal so that I don't overdo things. And that's one of the things I loved about this machine.
For those who get Bodytite, do they still need to combine that with post-op compression and massages?
Yeah, you certainly do, because it's very, in that sense, it's similar to liposuction in terms of the post-op care. So you have to do wear your compression. Massages also help. The longer you wear the compression, the better, and that's gonna help with the long-term results. And also, I would say pretty much most of the time, we're combining this with a little bit of or a lot of liposuction, depending on what you need. But it is combined. It's great to combine it with liposuction for maximal results. All right. Okay. So we talked about the different probes. Each size probe has different indications. It's used for skin tightening, hopefully avoid surgeries like brachioplasties and thigh lifts that have kind of visible, kind of uglier, wider scars. But if you're someone that has a lot of skin laxity, then you're not really a candidate. And so where this comes up is mostly like in the tummy, right? So you have a lot of excess loose skin. It's kind of like a pannus, it's really hanging down. Then the Bodytite's not going to help in that situation. You really need a tummy tuck. And of course, there's other advantages to the tummy tuck that you can't get with just a Bodytite and liposuction. Of course, if you have separation of your muscles, you have diastasis, you have an umbilical hernia, all these things, we can repair when we do the tummy tuck that we can't repair when we're using this. So I think the tummy tuck is still an awesome procedure to kind of deal with a lot of things at once, such as say a diastasis plus loose skin plus some excess fat in the flanks and the waist.
Can you briefly just cover the areas of the body where this can be?
It can potentially be used in any area of the
thighs,
body, but the most common areas are the inner thighs, the abdomen, the arms, and then the chin and kind of neck area. Those are the most common. Out of all of those, what's the kind of the add-on that we do the most? It's typically the chin and face. Honestly, if I had my way and then people listen to my recommendations, I wouldn't do a chin neck without it. I think if you're gonna do the chin and neck, then you should be doing the face type combined with the liposuction, because that's really gonna give you the best results. Okay? All right, but there is a whole other kind of section to this machine that we haven't even discussed yet, okay? And that is what's called Morpheus, okay? So we have the Morpheus here. You can see that there, okay? And Morpheus is kind of like microneedling on steroids, okay? So perhaps some of you have heard of microneedling. Microneedling is when typically you do it to the face. A lot of people combine microneedling. But this is microneedling with that RF energy. So you're adding energy to the microneedling, okay? And then you can, if you want, you can still add the PRP as well. And so this really helps at the skin level, anywhere from 1 to 4 millimeters. So it can be kind of fairly superficial with a 1 millimeter, and that's what most microneedling is. But you can get deeper with this. You can get up to 4 millimeters, which is quite a bit. And then once that needle comes in, it shoots out that RF energy, and that really causes some very nice skin contraction. So that works well for pretty much the entire face. You can do that all over the nasolabial folds, the lower lids, pretty much the entire thing, the cheeks, the forehead, the crow's feet, and it works really well. And you can even do it in areas that are not the face. Of course, you can do the neck, you can do the chin, you can do the abdomen. If you have the skin that's fairly tight, or not tight, but that it's not completely loose, but it's that crepey skin with sometimes with a lot of stretch marks, that type of skin, you can use it there and it'll help that significantly as well.
So you can combine Morpheus with Bodytite and FaceTite.
You could combine everything. You could pretty much put it all together. I think one of the best combinations are doing if we're talking about facial rejuvenation, and you're wanting to avoid like a surgical thing such as a facelift or blepharoplasty, we would do the FaceTite to the chin and the neck area, and then we would do the Morpheus pretty much to the remainder of the face, and we can do that all in one setting. And actually, if that's all we're doing, again, we can do that under MAC anesthesia, and you wouldn't have to do general anesthesia. Now, there is one difference. So with the Morpheus, typically it's not a one-time thing. For that one, we do recommend 3 sessions, and the sessions have to be spread out by a month. So 3 sessions for the first 3 months, and with that, then you're going to get a nice result that's going to last you, a long, long time.
What's recovery like for Morpheus?
So recovery this you can think of it like just like you would for any microneedling procedure. It's kind of one of those what do they call them, like lunchtime type procedures. Yeah. You basically you can get it done, and really you may want to go home that day, but you can go to work the very next day. There's very minimal recovery time. So I wanted to show you what the probe looks like. I'm going to see if I can try to kind of get it up close here. You see that there. You see the probe there. And then look at this. Let's see, we can get it close. Are you able to see that? Those are the needles. There's 24 needles that are coming out there. We'll show it over here as well on the Pure ID. So each one of those needles gets into your skin and then delivers RF energy. Okay, so it's a very, very powerful tool that we can use for basically facial rejuvenation and for skin tightening. It works with this kind of probe here on the machine. Okay, it's like a little gun, and so I just you put it and it kind of stamps out the needles, boom, 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 as we press the foot pedal there. So it's pretty cool, and I think it works much, much better than your classic microneedling, which is usually only like 0.5 to perhaps 1 millimeter with PRP and no energy. I think this works a lot better, and I would highly, highly recommend it. Okay. The other indication, sometimes it can be used for scars, and I've heard and I've seen that it can make scars a little bit softer, a little bit more supple, and that's another potential indication for the Morpheus RF microneedling.
If I want to get FaceTite along with Morpheus, is this under general?
So if we're just, say for example, we're doing FaceTite to the chin and the neck, and we're doing Morpheus to the remainder of the face, the entire face, okay? We could do that with just the MAC anesthesia. So that means so again, it's giving you an IV. We do give you some medication so that you're sleepy, so you're groggy, but it is not general anesthesia, okay? We're not putting you completely to sleep. We're not putting that tube down the throat and hooking you up to the machine, okay? Now, if you ask me, can I do Bodytite to the entire abdomen under MAC? For that, I think it's probably best to use general anesthesia. It is a large area. It does take a little while to do that, and then do the liposuction afterwards. And you'd probably be a bit too uncomfortable. We just try to do that with MAC. So for larger areas, I would recommend the general anesthesia.
Does Morpheus help with scarring, something like tummy tuck scars?
I've seen, yes. I've seen. I don't have a lot of experience with it myself, but I've seen a lot of research. A lot of papers have shown that the Morpheus has helped with scarring, and that is an indication to use it. Yeah. Does
Morpheus work well on women of color? I'm worried about scarring on the skin.
So it does. It does. The needles are all very, very tiny. So when you have tiny needles like this, the risk of keloids tends to be less. Okay. And so if you're worried about keloiding, usually the risk is fairly low. And the other thing that women of color a lot of times worry about is like lasers and whatnot. Usually, the darker the skin, lasers don't tend to work as well, and they can cause issues with changes in skin color. So this does not have any issues with that. We can do all what they call Fitzpatrick type skin types with this machine. There is no contraindication, in terms of skin tone when using the Morpheus.
So question, Bodytite versus Morpheus for stretch marks on the midsection. What's better?
So yeah, so I would say probably if we're all we're dealing with is stretch marks, I would say the Morpheus is better because stretch marks are very superficial. So it tends to be a superficial thing that's going on, and usually the skin where you have a stretch mark tends to be thinner in that area, and so the Morpheus I think will work best for if what we're focusing on are the stretch marks. Okay. All right. So, and then of course, I forgot to mention. So the Morpheus does come individually wrapped, also in its own kind of individual sterile package. So it's one probe per patient as well.
What's the pain level on Morpheus?
Okay. So certainly with with the MAC, it's very, very tolerable. But like I said, Morpheus does require a total of 3 sessions. So it's not uncommon that we do the face site to the chin with the Morpheus to the entire face under MAC, and that's kind of the first session. But for the second and third session, you don't actually necessarily need to do MAC. We can do it here, basically in the clinic. And so what we have to do is get you to come in early so we can put the lidocaine cream over the face. It takes approximately 30 to 45 minutes for that lidocaine cream to work. And then we combine that with what we call nerve blocks. So I'm able to block some key nerves in the face as well. And then when we do that combination, then the pain is not bad at all. It's very, very tolerable. So we got to combine it with lidocaine cream and nerve blocks so that we can then do the other 2 sessions here in the clinic setting.
So what about patients who are coming from out of town?
Yeah, so unfortunately, Morpheus is a little tough for the out-of-town patients in that sense because it's not a one-time thing. For best results, it would require the 3 sessions. So you would have to kind of make a commitment to that. But the great thing about everything else, the Bodytite, the face site, I can tell you that is a one-time thing. So that works great for patients that are coming out from out of town. Because they just need the 1 session, they're good to go. And then they're going to see those results continuously improve over the course of the next 4 to 6 months.
So Bodytite, Accutite, and FaceTite require 1 session. Morpheus is 3. And how far apart are the 3 sessions?
1 month apart. Yeah. All right. So that's exactly correct. And then the Morpheus is 1 month apart. And then after that, you should you'll see results that continue to improve again over that course of the next 4 to 6 months after your final session. And it should last, a couple of years or so at least. Okay, of course, there's always, do some maintenance and touch-ups and things of that nature. But it's kind of part of the whole, facial rejuvenation package. So as more and more we get more and more technology, we have different ways of rejuvenating the face that are not, completely surgical. So what does that mean? That means, there's a lot of maintenance to facial rejuvenation, but in that way you can avoid the big surgery. So you can do your Morpheus, plus minus PRP. You can do your Botox, you can do your fillers, and then of course, all your kind of dermatological creams and whatnot to kind of maintain the useful skin on the face. And then you want to do a couple lifestyle, things such as you want to avoid, sun, and you certainly, for sure, want to avoid cigarettes and nicotine. Nicotine is the worst thing that you can do in terms of facial aging. It's going to age your face 20 years faster than it should. So definitely stay away from the cigarettes and stay away from the sun as well.
I have loose skin under my chin. If I want to get rid of that, how long is the session, and will I have to wear any garment on my face post-op?
Yeah, okay, so like I said, so we can use the face site underneath the skin. That's going to help a great deal in terms of tightening up that skin. The procedure itself, if that's all we're doing, it's approximately 30 minutes or so. That we would do under MAC anesthesia. And then at the end of the procedure, yes, you would have to wear one of those kind of face, kind of chin type garments, kind of wraps around the face like this. And you're going to be wearing that for the first week, you're going to be wearing that night and day. So you want to wear that for night and day for the first week, and then after that, you're going to wear it as long as you can for the first month. So I know people, they have to go to work, they have to be out and about, and they can take it off during those times. But certainly when they're not being kind of face to face with other people, they should be wearing it, and of course at night as well, until you get to the the 1 month mark.
I'm currently using, I don't know how to pronounce this, tretinoin on my skin. My surgery is in July, lipo, BBL, face tight. When should I stop using before surgery?
The tretinoin, yeah. So you should try to stop that approximately 30 days before surgery, so that there is some of it does get into the bloodstream. You just want to avoid that, so you can use it. Stop at 30 days before surgery. That would be the safest.
Where are the incisions made on the inner/outer thighs for Bodytite?
So on the inner thighs, try to get to as close as the groin crease as we can, but of course we want to make sure that we're able to target all the areas that we need to target. Okay. If we're doing outer thigh, it's typically kind of in the upper hip area, basically. It would be there so that we can reach the areas that we need. So of course, we want to try to hide the incisions as best as we can, but at the same time, we want to make sure that the probe is reaching all the areas that we need to target as well.
If you can even demonstrate how small are the incisions?
So they're all, less than 5 millimeters. So they're very, very tiny. Here, I'm not sure if we can get a good view of the needle there, but the only thing that needs to go inside is this needle here. Okay, so this needle right here. So it's a very, very tiny incision. It's actually the only reason why the incision has to be a little bit bigger is not because of this, but because of the cannula that we use afterwards, to follow to do the liposuction. So I would say the incisions, for larger areas are probably about 5 millimeters, and then for small areas like the chin, where we're using just a 3 millimeter cannula to follow, it's approximately 3 millimeters. So very, very small.
I'm 27 years old. Is that too young for Bodytite on the chin jawline?
No, it's certainly not too young. It's really more about how you look and how you feel physically. So if you have that loose skin there, you can be 27 years old, but perhaps you've had a couple pregnancies, or perhaps you've gone through some fluctuations in weight. All these things can cause skin to become loose, to become lax, and that's going to certainly help you with that. And the younger you start, the better longer term results you're going to have.
So how does Bodytite to the arm compare to arm liposuction?
So if you have very, very good quality skin, and you have some excess fat to the arm, and for those particular cases, you can do the liposuction alone. Okay, and you'll get a certain degree of skin retraction with that. But I would say that for most patients, you're probably going to need to add the Bodytite to that. So you're asking me to compare, but it's really not. We're not doing really one thing or the other. We're either doing liposuction alone, or we're doing Bodytite plus liposuction. So the Bodytite always kind of includes a certain degree of liposuction. Okay, and then in general, if you're doing both, you're going to have a better result, because you're going to have better skin retraction, and so the arm is going to look, basically thinner. The skin not as hanging when we do the combination there.
Can this replace an arm lift?
So it can in a certain sense. Like I said, if you have severe skin laxity, then you're not a candidate. If you have kind of moderate skin laxity, where you could potentially do an arm lift or do this, it'll certainly make the arms look a lot better. Is the result maybe going to be as extreme as an arm lift? Maybe not, but you're not having that huge scar. That's really the main thing. So you're going to have a very nice result, and you're at the same time able to avoid that big scar that goes kind of from the armpit all the way to the elbow, which is very, very visible, and also a lot of times tends to be wide. You got to go through that whole kind of recovery. Sometimes the wounds open up because it's an area that we're using and moving all the time, and so you have to deal with small open wounds and things of that nature until everything fully closes. And then the other thing that sometimes happens with that brachioplasty scar as well is that because it is an area that we're moving, we're using all the time, there's also higher risk for kind of thicker scars or truly hypertrophic or keloid scars in the arm. So this would help you avoid any of those potential issues.
Can you combine a BBL with FaceTite and arm liposuction?
Yeah, you can certainly do that. That's actually a fairly common combination. So we can do the BBL, we can add the lipo to the arms, plus minus, Bodytite to the arms, depending on how things are, and then doing the FaceTite plus a little bit of lipo to the chin, and that could all be done in one setting. Mm-hmm.
And I know you answered this before, but how long is one session?
Well, so it depends on what we're doing, the area that we're doing, okay? So if we're just doing, say, the chin and neck, that's fairly quick, that's like 30 minutes. If we're doing an entire abdomen plus lipo on top of that, it would add, approximately 20 to 30 minutes to the liposuction. So the entire kind of session would be, say, an hour and a half for, say, we're lipo 180, we're just doing, we're doing lipo to the anterior trunk, the abdomen and flanks. So it does add some time to the procedure, but I think it's well worth it, for the patient to get that skin tightening.
I recently had a BBL. How soon can I come in for FaceTite?
So you want to be fully recovered from the BBL. Make sure that everything's okay and that all the inflammation and everything else is settling down. So I would say I would say you want to probably wait about 3 months. Make sure that you're fully recovered, that you're doing well, and then we can do it. Is it possible to do it sooner? It probably is. Because we're working in an area completely different from what we had worked on in the BBL. So it's more so about just making sure that you're feeling better, that your hemoglobin levels are back to normal, that you're feeling strong again after the BBL, and then doing the next procedure.
With you being so busy, how do you stay on top of all the changes in the industry with new technology and devices?
There's a few things that or a few different avenues that we take in order to kind of stay on top of things. So one of them is staying on top of the plastic surgery literature. Simply by being a member of the ASPS and other plastic surgery societies, you do get literature that comes into the office, such as the what's called the PRS journal. So that's one way. And then another way is that we go to meetings, basically. So I attend 1 to 2 meetings a year, where you take a break from the office, you take a break from surgery. Typically, they're in different locations. Chicago is very popular. Some of them different areas here in South Florida are very popular as well. And you go to these meetings and you see plastic surgeons, present different technologies, present the results. And so that way you can stay on top of what's happening in the plastic surgery world. And then the third way is actually some of them come to us. So we always have reps from the different machines, different companies calling the office. They're interested, of course, in selling their products. But they present, they make their presentations, they show their evidence, they show their papers, they show their before and afters, and that's kind of a starting point. If something sounds interesting, you can kind of take that, consult with your colleagues, look at the literature, perhaps see someone present in a meeting, and then make a decision as to whether you want to move forward with that new technology.
In terms of Bodytite and Morpheus, are you the only one at Pure Plastic Surgery who conducts these procedures?
All right, so in terms of the Bodytite, I would be the one performing it because that's done in the OR. So I'm certainly the one doing that. Now the Morpheus does not necessarily have to be done by me. That can be done by one of our staff members here in the clinic. And so that doesn't require, the presence of basically of an MD. So that's an advantage there as well. So if we're doing it in the OR because, we're combining it with the face and everything else, and of course I'll be doing it there. But if it's, say, session 2 or 3 here in the clinic, one of our staff members could perform that session. All right, everybody. So I hope, I know there were a lot of questions coming in about this technology. I hope that answers a lot of those questions. We've been using it now, how long now? It's been I don't know, 5 months maybe. Of course, we took the break when we were shut down, but we've been using that for quite a few months now. We're very, very happy with it. We're starting to get some like beautiful long-term results. As I said, they continues to get better over the course of the first 6 months. So we're really, really excited, and we're just looking at more and more ways that we can use it to help with skin tightening. Okay, so we will see you guys next week. All right, we will be right here on Hump Day with Dr. Earle. All right, take care, everybody. Ciao.